Gentlemen, I've just reviewed this year's STI data, and the trend should wake us up. In 2024, the U.S. still recorded more than 2.2 million chlamydia, gonorrhea, and syphilis cases, even after a 9% drop from 2023. Not every change on your penis means HIV, but repeat infections quietly weaken your defenses and open the door to bigger problems. I'm Dr. Jame, a urologist focused on prevention, clean safe, and pain-free, risk-free. Tonight, I'll walk you through 5 infection-linked penis symptoms men overlook, how to check yourself at home in 1 minute, and when to test for STIs and HIV. Stay with me until the end because I'll give you my C-Sense scan framework and a 3-step routine that brings calm confidence to your sex life without constant worry. If this resonates, please subscribe and comment 9 to help us reach 1,000 and help many more men. Listen up, my friend. After this segment, you may head straight to the bathroom mirror. I'll cover symptom 1 in 60 seconds, clearly and clinically so you can act with confidence. Here's the pattern I want you to notice. 1 to 3 days after sex, the glands look slightly red or irritated. It then settles down in 3 to 5 days. Then it returns after the next encounter. That flare and fade loop is the red flag, not the intensity of any single episode. The most common culprits are low-grade yeast or chlamydia-related irritation that weakens the mucosal barrier. Microinflammation creates tiny entry points and makes other infections easier to take hold. Your job at home is simple. Keep a private log tied to sexual activity. Note the date of sex, the day redness starts, and when it resolves. Take a clear photo. Avoid guesswork treatments. Do not rotate antifungal creams, steroid ointments, or harsh soaps hoping to speed things up. Quick fixes blur the picture and delay the right test. Use warm water only. Pat completely dry. Wear breathable underwear and let the skin rest. If friction is likely, use condom plus lubricant to reduce micro tears. Here is the action threshold. If this flare repeats 3 or more times within 2 months, schedule a visit. Ask for a full STI panel and a combo HIV test. If your risk profile is high, talk with your clinician about PrEP. If there was a recent exposure, ask about PP timelines. Don't be embarrassed. I help men with this every week, and clarity always feels lighter than worry. What matters most is the repeating pattern, not whether today looks mild. Have you experienced redness that keeps returning after sex? Comment 1, and I'll share a testing timeline and a skin recovery checklist tailored for men. Remember, the goal is not fear. The goal is ownership. Track, verify, and treat the cause, not the guess. Try this in the morning, and you will remember it. After today, you'll think of me every time you check, because the instructions are short, practical, and easy to recall. We are talking about thin, stringy, clear discharge with little to no smell, often mistaken for leftover semen. Sometimes it appears only after sleep or with a light press on the urethral opening. The usual backdrop is mild urethritis in an early phase, a shift in local pH, or biofilm from low-grade bacteria. That combination quietly irritates tissue and lowers the barrier to other infections, including HIV. A quick data note. CDC surveillance released September 2025 tallied more than 2.2 million chlamydia, gonorrhea, and syphilis cases in 2024, despite a 9% decline from 2023. Progress, yes, yet the burden remains high and repeat infections are common. CDC +1. Here is the standardized self-check. Tomorrow morning, before you urinate, wash your hands, use a clean tissue, gently press the tip. Look for a faint white or cloudy thread, note any tackiness, and take a time-stamped photo. If this finding persists beyond 7 days, especially when it shows up even without recent sex, book an appointment. Ask for NAAT testing for gonorrhea and chlamydia, and include an HIV screen. CDC +1. Be kind to your skin. No harsh soaps, no internal rinsing, and do not squeeze hard. Warm water, full dry, breathable underwear, and patience protect accuracy and healing. If your risk is elevated, discuss PrEP with your clinician. If a recent exposure occurred, ask about PEP windows. After treatment, CDC advises retesting at 3 months to catch reinfection. CDC. Have you noticed a morning discharge and ignored it? Comment 2, and I'll send a step-by-step testing checklist. If this helped, drop a sticker to fuel the mission. If you want the longer version with timing charts, comment 0, and I'll pin the expanded guide. Next, we move to a warning you can't see but you can smell. You've listened this far. Don't stop here, because in over a minute you'll understand why this sign matters. Hearing is your instrument now, not only sight, and a quick smell check can change what you do next. Your nose is an early warning system. The typical signal is a light metallic or slightly sour odor, plus lingering damp warmth in the groin fold, especially after the gym or a long day in tight clothing. It can return the next afternoon, even after a thorough shower. What's happening underneath is usually a skin microbiome imbalance. Sweat, heat, and friction inflame hair follicles and oil glands, so the barrier gets tired, making micro-injuries and opportunistic overgrowth more likely. Care is simple but precise. Change out of wet shorts or underwear, pat completely dry after bathing, and prioritize breathable fabrics. Skip harsh soaps, alcohol scrubs, and fragranced washes that strip natural lipids. Use lukewarm water, a mild cleanser only once daily, and a clean towel dedicated to the area. When to see a clinician is about persistence and pattern. If the odor lasts longer than 3 days despite correct care, or you see a red rash or pinpoint follicular dots, request yeast and bacterial testing. If your risk profile suggests it, include an HIV screen, because irritated tissue is easier for pathogens to exploit. Proper diagnosis beats cycles of deodorizing sprays that hide the clue but miss the cause. Psychologically, many men blame hygiene and move on. I did the same in my 20s, and I understand the instinct. But avoidance never outperforms observation. Don't dismiss repetition. The repeated pattern is the message, not yesterday's intensity. Meet the symptom with calm notes and a plan. If you've battled a stubborn odor that won't quit, comment 3, and I'll pin a post-shower routine you can try tonight. Thank you for staying with me. Next up is a tiny sore that disappears fast yet carries outsized risk. This symptom looks small but carries outsized risk because it is, by definition, a break in the skin. Quick humor to make it memorable. Many men admit they absent-mindedly scratch an itch down there and move on. I get it, but a tiny open spot is still an open door. The common habit is to dismiss it as friction from sex, shaving, or tight underwear. It fades quickly, so the mind files it under nothing. That is the trap. Clinically, we think in terms of micro-injury or an early, fleeting, chancre-like lesion. Even when short-lived, it can serve as an entry point for pathogens or coincide with other infections you cannot see yet. Short duration does not equal low importance. Smart handling starts with restraint. Do not cauterize with home remedies, acids, or burn-off sticks. Do not cover it in steroid or antifungal cocktails. Leave it alone so your clinician can see the true picture. Document instead. Under bright light, take a clear, time-stamped photo and note the exact day you first noticed the sore. Mark a calendar reminder for day 14. Around 2 weeks after the first episode, schedule STI testing even if the sore vanished. If you had a recent exposure or any added risk, discuss an HIV test on an appropriate timeline and set a reminder to retest at the window period your clinician recommends. Accuracy beats anxiety. Watch for companion signs. If you can feel a small, pea-like, painless node in the groin crease that persists beyond 2 weeks, tell your doctor. Persistence matters more than size on any single day. If this description sounds uncomfortably familiar, comment "Me too," and I will outline a step-by-step plan you can follow without guesswork. Silence is not safety. Pattern is truth. Next, we'll shift from what you see on the skin to what you feel inside. Subtle heaviness in the groin or a dull ache in the testicle. We've reached the last symptom. If my clinical pacing feels a bit heavy, stand up, stretch, take a breath, and keep the speaker on. I want you alert, because this one depends on what you feel inside, not what you see. Your attention matters here. Here is the picture. A gentle pulling sensation or a nagging heaviness sits low in the groin or the back of one testicle. It is not sharp. There is no fever. It simply lingers for days. Medically, chronic urethral irritation can travel along the tract and irritate the epididymis. Microinflammation disrupts microcirculation, so tissues feel congested. Left unaddressed, low-grade STIs can create a cycle of flare, rest, and flare again. Give yourself 5 days of structured observation. Each day, write a simple 0 to 10 pain score. Note the time it peaks and whether activity, sex, or prolonged sitting worsened it. Add yes or no for swelling or redness. Here is the threshold to seek care. If the ache lasts more than 5 days, or you can feel a small, painless, pea-like groin node, book an appointment. Ask for scrotal ultrasound, urinalysis with culture, NAT for gonorrhea and chlamydia, and an HIV screen when risk is present. Recovery is practical. Ease off heavy lifting and sprints for a short window. Use supportive underwear that lifts without squeezing. Sleep 7 hours. Cut alcohol and nicotine in half. Hydrate and avoid prolonged heat from saunas or hot tubs. This is a felt symptom. If you do not speak up, an observer may never guess anything is wrong, and the opportunity to act early can slip by quietly. If you've lived with groin heaviness that keeps returning, comment 5. And I'll pin a pre-visit checklist so you walk into clinic prepared and confident. Next, I'll connect all 5 signs using the C-Sense scan framework, so you can move from noticing to knowing, and from knowing to a calm, repeatable plan. Here is the distilled method many clinicians teach. I will give you the essence in 90 seconds. If I move fast, tap slow playback so you can catch every step. See, look, take 60 seconds after your shower. Stand under bright light. Check the skin tone, folds, glands, and the urethral opening. Note any spots, patches, flakes, tiny sores, discharge, or crust that was not there yesterday. Sense, feel. Pay attention to signals that linger. Itch, dryness, warm dampness, odor, changes, pulling in the groin, or a dull testicular ache that lasts more than a few days. What repeats matters more than what screams once. Pattern beats drama. Scan, test, schedule the dates. Test for STIs and HIV every 6 months or sooner after a risk or a new pattern. Ask for NAT when urethritis is suspected, and follow your clinician's window periods for HIV retesting. You asked for proof that this approach works. Instead of quoting national numbers that change each quarter, I will tell you the part that never changes. Men who observe, record, and test on time reach answers sooner, treat earlier, and stop the cycle of guesswork. That is the outcome you want. Try a 30-day implementation. Week 1. Learn visual check and store a private photo baseline. Week 2. Keep a simple log of symptoms tied to dates and activities. Week 3. If a pattern appears, book testing and discuss prevention, including PrEP or PEP when appropriate. Week 4. Lock the routine with reminders so it runs on autopilot. If C-Sense scan lowers your anxiety, comment I choose clarity. I will pin a PDF checklist you can follow step by step privately. We now have a framework. Next, avoid 3 mistakes that derail it: random creams, silent shame, and trusting a single negative forever. You've learned the core method, but many men still fall into patterns that quietly undo progress. Listen closely, because avoiding these mistakes makes every observation, note, and test more meaningful. Mistake 1. DIY diagnosing and cream hopping. Googling, rotating antifungals or steroids, and scrubbing harder suppress surface signs while the real cause simmers underneath. You chase temporary improvement, not durable answers. Hold your fire. Preserve the clinical picture so targeted testing tells the truth. Correction. Follow the time rules. If a skin lesion won't settle in 10 to 14 days or keeps recurring after sex, book a visit. Photograph clearly, stop new products, and bring your log so your clinician sees the story. Mistake 2. Silence with partners and clinicians. Embarrassment delays care, fuels reinfection loops, and leaves you guessing alone. A brief, honest message to a partner and a straightforward appointment shorten the path from worry to clarity. Correction. Use plain language. I'm seeing a repeating rash or discharge. I'm getting tested this week. I'd like us both to check and to treat if needed. This is leadership, not alarm. Mistake 3. Trusting one negative forever. Window periods exist. A single negative after recent exposure may calm the mind but not close the case. Respect retest intervals so your results match biology, not hope. Correction. Remember the retest cadence. Repeat testing at 4 to 6 weeks and again at 3 months, guided by your clinician and exposure risk. Pair this with NATE when urethritis is suspected. Universal rule of thumb: 10 to 14 days for a non-healing skin change, more than 5 to 7 days for persistent discharge or odor, and more than 5 days for nagging groin heaviness or ache means you schedule care, not guesses. Which of these have you faced? Comment 6, and I'll pin a testing timeline tailored to your situation. If none fit, drop a sticker so you're still tracking well, and keep going. You want an approach that is accurate, efficient, and sustainable. Here is the plan I give patients who want clarity. Step 1. Observe 1 minute daily. After your shower, stand under strong light and scan the glands, folds, shaft, and urethral opening. Look for new redness, flakes, tiny sores, discharge, crust, or swelling. Breathe and notice. Step 2. Record. Keep a private log. Note the date, what you saw or felt, whether sex, workouts, or long sitting occurred, and attach a clear photo. Mark any recurrence so patterns emerge objectively. Step 3. Test. If a pattern appears or a finding crosses the time thresholds, schedule care. Ask for STI testing with NET when urethritis is suspected, include an HIV screen, and discuss PrEP or PEEP based on your risk. The time thresholds are straightforward: 10 to 14 days for a non-healing skin change, more than 5 to 7 days for persistent discharge or odor, and more than 5 days for groin heaviness or a dull testicular ache warrant an appointment. Keep the skin and your system resilient. Sleep 7 hours, train 3 times weekly, wear breathable underwear, and reduce alcohol and nicotine. Hydrate, cool the area after workouts, and avoid extended sauna or hot tub exposure during recovery. Nutrition is supportive, not magical. After medical review, consider vitamin D and zinc if levels are low, and build real food meals with protein, fruit, vegetables, and healthy fats. Consistency matters more than perfection. Keep doing the routine and you will see whether it works, because your log will show fewer flares and faster resolution over time, not just good intentions. If you commit to one change today, comment "Start today" and tell me the step you're choosing. I'll reply with a short checklist so you can act immediately and track progress with confidence. First, thank you for staying with me to the very end. Your time matters. Your attention fuels this work and helps me keep serving men with clarity and respect. Here is the quick recap. 5 infection-linked signs deserve your attention. 1. Recurrent redness after sex. 2. A thin morning discharge or faint white stain. 3. Unusual odor with warm dampness despite careful hygiene. 4. A tiny sore that vanishes. 5. Groin heaviness or a dull ache. Do not wait for pain before you act. Patterns and timelines tell the truth more reliably than a single dramatic day. Track what repeats and let the calendar guide decisions, not anxiety. You now have 2 simple tools. See. Sense. Scan gives you a 1-minute check, a focus on lingering sensations, and a testing cadence every 6 months or sooner. The 3-step routine turns that framework into action. Observe, record, and test when thresholds are crossed. The message is straightforward. Knowledge protects. Awareness strengthens. HIV and STIs are not a life sentence in modern care. With prevention and timely treatment, men live long, confident, connected lives. If you reached this point, you already lead by example. Your comments and a single subscription help carry a stigma-free message to people who need it, often silently. I am grateful for your trust. Your body deserves informed care, not guesswork or fear-driven delays ever. Before we close, choose one next step and commit today. Start the nightly check, create your private log, or book testing if a pattern is present. Small actions, repeated, change outcomes. Comment the number 9. It is our symbol for moving forward. Subscribe if this helped you, and share it with someone who might benefit. I am Dr. Jame, and I am here to keep your health simple, calm, and strong.